Well, this is going to be good. Today we have Ranger coming in first, and then 7 more behind him. They're going to have their work cut out for them in there. Ranger's a nice dog. This is a happy dog. So we'll see what happens in there. Sometime like we did the other day with Sophie. She's so happy and outgoing, but she's really covering up for her scars. And she was very nervous to the point where she didn't want to be held down, and they had to sedate her. So we'll see what happens today with the rest of them. Ranger's coming in next, and once we're done with these intakes, then we're done with this whole batch. Then the next step is for me to go tell them what's going to happen after their intake. The blood work comes in. We find out if they need medicine or if they're okay, good to go. And I'll be telling them, this is temporary. You're going to have a nice home. Trust me. And then we move them to the permanent yards out there. So we're going to begin the intakes. I've got to get in there, and they're going to bring Ranger. You have who's here?
Ranger.
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 What did Ranger do to me the other day? What was his thing?
Ranger, by their records, he was born November 22.
Oh, he's a baby, yeah.
He's only he's not even baby. Quite 2 yet.
1-6, a year 6.
Yeah. A year 6.
All right, Doctor.
Hey, Ranger, how's it going, buddy?
Ranger, look at the boy. Look at the boy. Look at the
Grab my
boy.
stethoscope.
You're the beautiful boy. Yes.
Come here, pal. Just me pawing on you a couple of minutes, buddy. And then okay, let me feel his undercarriage. He walked over here okay?
Yeah, you walked over okay.
Good. David, did you? Thank you. Okay, we need blood for a panel and an Ehrlichia PCR, and I'll check his vac status while you're doing that, and then he does need a chip. But he seems like a pretty healthy boy. Yeah, he's not due for a rabies until November. I'll put a reminder for that instead of doing it. So no vax for this one, Stephen. What's that? All right, what did he weigh?
48.6, right there? 48.6?
Yes.
You doing that now, or are you going to let him go
Yep.
back?
We're going to do it now.
Ranger.
48.6, you said?
Yeah.
Let me go get the sedative. Excuse me, Alex.
Come here, baby. Come here, baby. Come here, baby. Come here. Come here. You want to see? You want to see? Whoop. This is surgery. Those are kitties. Oh, he didn't mind the cats. Who's that? Who's that? He didn't mind them at all.
No?
No, he didn't pay any attention. You're going to go sleep in there. Yeah. Hi. Hey.
Okay, Steven, you want to come hold this guy for the sedative?
We got a blood shot or is it just
It's a butt shot.
Yeah.
Ready, Dr. Mo?
I'm ready. Are you ready?
Yeah, ready.
Ouch, I'm ready. Oh, that hurt. Whoa, that hurt. Oh, that hurt.
Yeah, we're not. We're
By the
not
way,
gonna-
you missed him and
we're
got
not, we're not going to talk about your holding skills.
me. We know that.
Right. We'll take the food and water out of that one, I guess.
We're famous
But
for...
the nice thing about this is it's a short-acting anesthesia and it's not an anesthesia, a sedative, and then as soon as we're done, it has a reversal, so we can give them a reversal and he's
We
right
should
back
tell
up.
them. We should tell them my holding experience.
Holding experience. When I had a private practice, it just became legend that whenever Leo came in with an animal, we didn't allow him to hold them for anything, because his idea of restraint is asking them to volunteer to be still.
To this day, I
yes.
cannot. I cannot. You have to hold them, but they hold them like a vice grip. I mean, they got to like, they can't move. I can't do that.
David, let's look at one of these cats while Kevin's getting
No, not him.
the next one.
I remember we'd be down in the old practice, and I come in and I'm holding the animal, and then you'd hear Dr. Brown go, "Scott, get in here." Remember, Scott, get in here. You're still going? Are you still going?
Oh, yeah.
You still going? Supposed to drop him like a fly. Jennifer. Let me see if she remembers. Come here, honey. Come here, honey. Come here. Come on. I didn't wash my pants at all. You can smell. See? Smell your friends. Pretty girl. Have you tried any climbing out?
I don't believe so, but we did put her in the.
Yeah, she's in the, yeah.
All right.
Here you go.
Jennifer does need to be vaccinated, okay?
Try to get
And
blood
rabies,
first and see-
right, and see how she goes.
Did they skip her, or was
No,
it
it
just
was,
outdated?
it was given in March of 2023. It was a 1-year rabies vaccine.
Oh, so she didn't get
So-
the other stuff at all?
Oh yeah, she got the other stuff
Oh,
at the
so you're
same
just doing
time.
rabies?
So I'll give her rabies and
Okay.
the distemper parvo, and then it'll go on our 3-year cycle.
Right.
Good job. Have to get a little more blood than normal because we run that Ehrlichia PCR test on all these guys. That used to be rampant there as well because they didn't do anything for the ticks, you know.
Right.
And that's another thing I've been pleased about this group is they're not all parasite ridden, and they've dewormed them, and I mean they just their quality of
Yeah, we got a better group.
they're more up to snuff.
A better group. We can... Well, again, we had the hard cases come in first, so
Yeah.
it's
The ones with the ear
first in,
infections.
last in, first out.
Right. Let's let her stand up so I can. I want to feel her undercarriage and look at her back feet.
She says, I've never been so violated in my life.
Yeah, she looks good. What did she weigh?
Sorry, I called it
It's
out.
alright. We can give
Wait.
her-
Yeah, we'll do it on the way out.
Okay.
And she didn't even scream. All right.
No, it's just hard to.
Hard to know which ones.
Yeah. Alright, just the weight.
Yeah.
46.
46.6. Okay.
Yeah, we'll go with that.
That's about it. 46.6.
You think he's out?
As out as he's gonna be.
Oh, he's down. He's wagging his tail. He's still wagging. He's sleepy as hell, but he's wagging his tail. Right, still, look, he's still going to try to come out. He's going to try to come out.
Is he?
Yeah, he's.
Well, I think he should be manageable by now.
Yeah, he's down. He wags his tail and he's trying to come out.
Yeah.
That a boy, Ranger. You're going to be an old man someday. You're going to be an old man someday. Yes, you are. Yes, honey, I know. I know. I know. You're the good girl. You're the pretty girl. Pretty girl.
I don't think they want me to film.
Pretty girl. And then she gets her chicken and beef and all.
You can ask him if I can hold him.
You want him to hold the dog for me, but because of the arms, or do you want me to hold the dog back around?
You.
Yeah.
Okay.
Should have thought of this, David.
Yeah.
Sorry. Too much tequila. You should have thought of this.
You want me to put a towel down?
No, I can, let me get a stool and I'll do him right here. And this one, he doesn't need vax, but he does need a chip.
Boom. A nice shot. Nice shot. Oh, yeah. There was.
I've never seen so many people.
Oh, I'm doing it from him in a chair.
You gonna do a cat first?
Nope.
You gonna do him? Let me get out of the way.
Since he's ready to go, then we can do his reversal.
Here you go, I'm gonna just pull the whole bit out right here.
Just pull the whole bit out. And grab us a chip, David. I already looked you over. You're a good boy. We need to chip him. You won't feel that. Thank you. Sorry, buddy. Okay.
Now, everyone watching this should warn their children's children. You'll be next. If we don't change things, you'll be next.
That's true.
That's true. Yeah. Put a chip in everybody.
Okay, so
Remember when we had
reversal,
freedom? Yeah.
Yeah, I'll get the reversal right now.
And we're done with that guy. Just in time for the next one.
Who's coming in? Oh, another active one. Let me check something. Let me see something. Let me see something. Let me see something. Good girl. What do we have for age on her? She's the oldest.
How old is Camila?
Camilla was born in October 2019. She was just vaccinated this month.
She was born in October 19th.
So she's not even 5?
So that
Wow.
makes her 5 years old, or 4.5.
So you're gonna have a white muzzle one day. You're gonna have a white muzzle. You have a white muzzle someday.
She was just vaccinated this month. So we just need blood and chip and me to run listen to her chest and
That's my Abby started. My Abby was dark like that, and then after a couple of years, she started getting the white A little bit of white. No, she was about 7. She's pretty white. No, she's white. Everybody
Camila.
thinks she's a husky because she's so white.
You're a little older than
Yeah.
the rest of this group. She's about 4.5.
She's a survivor.
Yeah, you're already starting to get some
Yeah.
gray hairs on your muzzle.
It's been a rough life. It's been a
Yeah.
rough life. If
Yeah.
you know what I've been through.
Let's see what her teeth look like. Getting a little tartar on the back, but the front's still pearly white. Fabian, did you notice any gait deficits coming up?
No.
She's a little pigeon-toed, you notice?
Abby is too.
Is she? Let her stand up and I'll feel her back. It's all right, girl. They might be. She's got good flesh, shall we say.
We were doing this the other day, and one of the dogs is skinny. You got to keep an eye on him.
Okay.
Somebody said, wait a month.
What's that?
We have a skinny dog like one of the pups out there. We have
Yeah.
one of the ones is feed him as much as you want. He's skinny. So we got to put him on that multiple feed program.
And here's the chip. What
The whole thing
happened?
just popped out. As soon as I poked it in, the whole thing just shot back out the other way.
Did the thing go in?
Where's
No.
the
No, I didn't even push the plunger. It just the plunger
yeah,
itself.
well,
popped
where's
out.
the chip?
Probably right here.
On the floor?
Yeah, you want me to double check?
Yeah, just scan her real quick.
Next
make
to
sure
that? No.
it didn't fall out in her.
All right, hang on.
Is that it right there in front of you?
Well,
On
I
the
didn't
floor?
Push it in, so if it's in there, then it's just good.
That's the first.
That is a
I've never
first.
seen the plunger.
We had a-
I've
we
never
have
seen that happen.
A chip that explodes. But definitely not in her because you scanned her.
It's not in her. Maybe it was defective. Maybe there was no chip in it.
There you go. That's a
Huh?
good idea.
I tell you, quality control on our syringes has gone to hell in a handbasket. You know, when you used to avoid buying off-name brands
Right.
of syringes.
Right, we got to
because
buy the brand, which
we,
yeah.
we buy the brand name, and still, I would say, we've got a close to a 10% failure rate.
Oh my God.
That are, 10% is probably high.
What are they doing? What are
They're cracked around the barrel.
When you pop it open, this is already.
Oh my
This
God, you're
is
kidding.
already
And we pay a
broken.
fortune for these.
Yeah,
You have like no. If you're not
Look
paying
at-
attention and you put it in, then you have no pressure.
Right.
you got no
Right.
suction because there's a crack.
Same brand. They're the same.
I know, we pay.
Yeah,
buy
we're
the-
actually getting the name brand, but I don't find any difference in quality control now than
I did it.
we did with the
Like
non-name.
Ranger? Yeah, but it's not ready yet. Like another 30 minutes before she can eat.
I think David and I.
And
will
there's
do
a good
another
chance
tap.
from that makes more sense that there wasn't a chip in it
Yeah.
because it's nowhere around.
That's the first time I've ever seen it come back. Before I was able to push in it, it's like there was pressure. I put it anyway. Okay.
How small is it?
Like
A rice, piece of rice.
it's all right.
Who's that? Is that?
The other one, the boy in I-8.
Oh, that's Brantley.
Brent.
Brantley.
Who?
Brent.
Brantley.
Brantley. One foot was off.
No, we got the winner.
Oh, you got it? All right. Brantley. Hi, baby. It's okay. It's okay. It's okay. Yes, it's okay. Oh, he's shaking. Are you shaking? Are you shaking? It's okay. It's okay. Yeah, it's okay. It's okay. There's baby boy. The baby. It's all new. It's just all new. What's going on? He goes from the desert, then he goes to our satellite, and he gets fixed up a little. The ladies are good. They know how to take care of them. Then he thinks, this is it. I got these nice ladies. And then he gets a 6-hour trip to here and goes, what in the hell's going on? And all these people and all these smells, and I'm in a hospital. You can't fool me. Hi, Brantley? Right, Brantley? The poor boy. He's nervous. He's nervous. Well, I know my blood pressure goes up when I go to the doctor. Yeah, it goes up. It's called white coat. That's what you got. You got white coat. Yeah. Oh, okay. Oh, look at him shivering. It's okay. It's okay. It's okay, baby. Another. Crossing.
So just
Hey,
blood
Ruben.
and shit. Okay.
I'll bring your stool.
Okay. How you doing, Brantley? Huh? Are you okay? That's okay. He's not gonna be still. Let me get a sedative.
Petra. Who's that girl? 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 The pretty girl. Oh, the beautiful girl. Yeah. You're like our smallest one, right?
Yeah.
Are you the small one? You the small one? Little boxer. Just a little bit of boxer. Hey. Petra.
Year and 9 months, dude.
Who's the year and 9 months? Petra? 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 So Sydney, we're going to be feeding him a whole bunch of times, so...
Yeah, you put them on 3 times, and then they have to mix the dry food in both of their wet foods because he'll just kill any of the food.
So you can't have, yeah.
Yeah, but the dry food's getting mixed into the food.
Right.
Yeah.
Right. So she's...
For both of them, really. They both get
Yeah.
like that. But
How's the pup doing? Because Meg says he's still skinny looking. We drive up the driveway, he still looks skinny.
the ones on
The
VR?
yeah, the one out coming up the road.
Yeah, they're all like that, but they're good.
No, there's one who's really skinny.
They're all gaining. They're only 4 times a day. They gain weight. I mean, they're just
All right.
active.
They were the whole bunch was skinny.
The ones from
I thought there was one. Yeah.
Turquoise, the Indian group.
Right, the ones coming up the driveway.
Oh yeah, they were all like that, and then they all started finally filling out, and one of them's still not yet.
Yeah, right. That's the one she spotted. She says he's still not gaining. Well, we got to talk to him about that.
Okay.
That there's one still not gaining, because it's obvious to when she's coming up the driveway. Yes. Yes. You're the pretty girl. You're the pretty girl. You're just a... Oh, you know what you smell?
She was just vaccinated.
Oh, okay.
So this one's blood and chip only. You'll have to get one more chip. We're going to be short because that one, I want to, before I draw blood on her, I want to get to know her a little bit.
A nice girl.
She's another young one, not even quite 2. Let's turn it a little bit. Let me feel her undercarriage. It's okay. Okay, let's have her sit down. Let's put her back against the refrigerator. And I guess I'll get this brand new chip they just got out. They kind of make it look like you could open this at either end, huh?
Yeah.
With the way they put that knob.
Can you see the chip enough to see if it was the other one was? In other words, to verify before it's empty. Oh, it doesn't matter. Yeah.
Yeah.
I was just thinking, since that happened, in case it was empty.
Yeah.
Good girl.
I
Give her
was
a chicken.
thinking she was a little nervous, but
Give her a treat. Give her a treat.
she did good. Here, Alex, put that in the sharps container. And we should
No,
be
no,
able...
no, no. That doesn't go in there. That goes in the sharps. Yeah. Somebody would have got that. That was Petra. Is Johnny's next? Is that it?
Oh, I don't know.
Is Johnny?
Petra.
No, that was Petra, but so Johnny's next?
He's gonna bring one more. The other ones, he said we need to bring the sedation out there and knock them out there.
Is that right?
Yeah.
Oh, what about this one? Is it ready?
I think he's ready now.
That's Sydney.
This is Brent.
That's
Oh,
Brantley.
Oh, Brantley, the red. Oh, did Sydney go back?
Sydney went back.
We did her.
Oh, she went back. He went back. Sydney was.
Yes, went back.
Yeah.
Already went back.
Hey, Brantley. Hi, honey. Oh, he's out. Yeah, he's out. Yeah, he's okay. You're okay. You're okay. Oh, boy. So scared. They're born out there. If they survive, they're scared shitless. The world over. Poor guy. Well, that's why we made this place. Yes. Yes. You're a good girl. You're a good girl. Yes. You're a good girl. Look at this girl. Belle, she's got a bed, but she sleeps in the litter box. A lot of them do that. Well, why did they put the food in the bed? Somebody put treats in her bed. Somebody put treats in her bed. She's sleeping in the litter box because there's food in her bed. Come here. Come here.
You want me to get her new,
No, she's all right. It's just dry food. Come here. Somebody was doing her a favor. Look at her, the baby. Belly. Okay, yeah. That's a love bite. That's a love bite. Okay. I'm not cheating on you. I'm not cheating on you. Don't worry. I'm right here. I'm right here. You're a pretty girl. Yes, you're beautiful. You're both beautiful. That's an X16.
Stool still in there?
From? Oh, is the stool? No.
Good
Yeah,
girl.
Dave's grabbing one right now.
Okay. Gotta do the doggy.
stool's in here.
Gotta do the doggy.
Excuse me.
We'll let one go.
What's that? Oh, one of these cats.
Yeah. That was good diarrhea. Do we chip him?
We do need to chip
We need
him.
to chip him.
Yeah, but he does not need vaccines. Rear dew claws we'll have to watch out for. Let's see the other rear foot.
You know, Abby has doubles.
Does she?
She has double
Polydactyl
Yeah,
dew
the
claws?
Ducla, and the reason you never said anything is because they're always trimmed way down.
Down.
She bites them.
You're kidding.
She bites her own dew
Yeah?
claws since she was little. You hear her crunch, 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 crunch. She's done her own manicure or pedicure.
Okay, buddy.
David, you gotta give him a hand in a minute here. Yes, you're pretty. You're the good girl. You're the good girl.
You can just see the peak of the chip
Yeah,
on this
right.
one. You see it there?
Right.
There you go, boy.
Oh, I guess he's got him on.
Put that in the
You don't need a
sharps,
gem.
Alex.
What's it? Get it what?
Reversal.
To reverse the sedative.
Right. Oh, this James Bond stuff.
We call it the Elvis.
Yeah.
Take him down.
Yeah, get the girl to, David, clean that box. It's okay, baby. Look at you. You're a beauty. They're all beauties. Johnny boy. He's a little nervous, he's shaking, but you're okay, you're okay. Where's the stool? You just slide that one over. Johnny's a big boy. Johnny's a nice tall boy. Yes, yes. Come here, come here, come here. You're a good boy. Yeah. You're a good boy. Yes, you're beauty. You're beauty. He looks like our pups. He looks like the whole litter.
Yeah.
Coming up the driveway.
Yeah.
Oh, he's shaking back here. He's shaking. It's okay. I know, too much attention. But look at the smile. See the smile ear to ear? He's happy. Nervous, but he's happy. Come here. Come here. See the smile? Look at the smile. Yeah. He's a happy boy. Are they getting treats when they leave?
Yeah.
Yeah. Who's the boy? Who's the boy? Who's the boy?
Johnny, you're a long-legged little devil.
He looks like, I was saying, it looks like our pups coming up the
Huh?
driveway. He looks like that litter.
This one's 1 year and 4 months old, David.
It's still growing.
Thank you.
And what did he weigh?
56.8.
We should start a pool on some of them. Like, how much is he going to weigh in a year?
Yeah.
Start a pool.
Well, all those Huskies,
Yeah.
all last year,
Yeah.
Oh,
51,
unbelievable.
52, all this year, 86.
Oh my God.
84. Dr. Brown was like,
Because I came back in, they had weighed it, I said, did you get that weight right?
Right.
I mean, it was, it's okay, Johnny.
They get plenty of exercise.
Boy. Another rear dew claw one.
It's okay, Johnny.
Okay, Johnny, you did good.
I said that. That's what I said. I said, okay, Johnny. Right?
All right, so you need 2 sedatives for about 55 pounds.
Treats.
One we're gonna have to sedate out there. One we can get.
They get their
and
treats.
sedate here. But the other one is.
Who's getting sedated?
Archie and Pearl.
Pearl and Archie. Are they in the same run?
No, they're different runs.
Right.
Pearl's with Howie. Howie.
Huh?
Howie was cool, but Pearl was.
Yeah.
Now, how are they going to be sedating one and not the other? Should we take the other one out?
No, they'll be fine.
Pearl, 51.8.
Pearl. Little Pearl. Yeah, she's a little. Let's just let her do her own. It's okay, honey. It's okay. It's okay. We got to help you. We're gonna help you. Okay. There you go. You gonna wait for it to go down, or do her in the middle?
What's this one's name?
Pearl.
Pearl.
Mm-hmm.
I thought we just did Pearl.
Nope. Well, I just gave him a shot for Pearl.
Pearly.
You want to wait for her to come more, or you want to try it?
Is
I mean, she seems okay with the drug on board.
well, let's try it. Let's see. She needs shots.
Shoot the-
and
She does?
yeah,
Rabies and the other one?
rabies and the distemper parvo and a chip.
Alright.
And David, you want to know how old she is, right?
Yep.
She was born in April of 2021, so that makes her 3 years old.
Well, you know, they're
Pearl.
guessing the dates.
Yeah.
Everybody's guessing based on, oh yeah, she's about 3 months old. She's about 6 months old.
Did you just pull this up for me, Steve?
Yes, yeah.
Yeah, thank you.
Ready to go.
She's gonna have to sleep it off here, though.
Loaded, microwave.
You've been voted off the island. Come on, Pearl. try to get her. Well, she's quiet. Okay, Pearl. I didn't even get to know you before I poked you. Okay, pull her forward.
Do we have any of the Pearls here? Because Pearl's the horse over at Trail.
Right,
Yeah.
true, but that's the only.
Okay.
We'll go first.
Let's do the.
I took the blue thing.
Did you? Everybody knows this dog was sedated, right?
Yeah.
Okay.
You just have this way.
Yeah, I know. It's just I don't know if anything was said about that. I don't want people thinking that this dog is just lifeless.
Never mind.
It's
I thought they
special.
were full in there.
Okay.
Special touch. It's a spot that you hit. That you,
Right.
You know, the chips before the chips. Is that something down there?
That's the
Is that thing?
just the cap off the
chip thing. Thanks.
chip thing. Yeah.
Before they invented chips many decades ago, I remember we had a bad actor in here, and she changed the names of the animals on the charts.
Yeah.
She put new names on the charts, and we could never, can you imagine? Who's this? Archie. So he's the last of the intakes, right?
Yes.
Archie.
Archie's on the logs. What does he weigh, Fabian?
44.
44.4. You waiting for an age on this one?
So we had to
Sedate
sedate him in the
before
yard to
blood
bring him in
goes
here.
home in the exam room. Get a picture of him. He's the only one that we didn't have a picture of.
Archie?
No, we got a picture of Archie.
Oh, Brantley. Brantley's in here now, right?
Yeah. And just told him before he goes home, I want him to get a picture.
Hey, don't believe this. I have a lot of stuff in my pockets, like a shitload. I think I've lost weight.
Do you? All right, let's look this guy over a little bit. He looks way out of it.
From here, he looks like a red bone hound dog.
Doesn't he? He's little. Who was it that came in here the other day that I thought of hound dog immediately? I can't remember.
How slow's the heart rate when they're sedated?
Goes down to about 33, 35. They- Stephen, I don't know if I'm going to be able to get down to this guy's level. Either if you can get down here, we won't have to lift him up, but if we have to lift him up, I got to do it on the table in there.
Okay, whichever you prefer.
Go. I know you can do it, so.
You're kind of like Jack the Ripper, you know? You see what he does?
He's not going anywhere, Fabian. Get the towel down first.
You a ganger? Were you a gangbanger? You see him go? Oh, Dr. Brown
Yeah,
goes,
well, well, that's very typical for when you got plenty of blood pressure, but when it.
All right, we got a.
Yeah.
Rough. Look at that
Let's
boy.
see. Let me get a different
Look
syringe.
at that boy.
I got it out of your box, man.
There's a
Did
boy.
you?
Yes.
It looks like a boy.
Excuse
It's a
me,
baby.
Alex.
It's a baby. How old is he?
Let's go. You go over there.
How old is he, Dr. Mom?
He was.
No, just guess. Just
I'm thinking he's 2. How old is
because
he?
he looks like a
One,
pup.
Huh?
Like 1, 9, 1, 10, or 1 year, 10 months, 1 year, 9 months.
1 year, 9 months.
Wow, he looks like a lot younger. We're kind of crowded here today. Now you want to put a Christmas stocking next to him. It makes Christmas morning he wakes up.
Let me palpate him. I didn't do that before.
Well, he's the most out that anybody's been today.
Yeah, he is. Let's get him reversed. He is really out of it.
Yeah.
I put him right here.
Okay.
You're gonna have to use more because he's so sedated.
No, typically not. It attacks receptor sites, so the reversal agent attacks receptor sites. So he only has so many receptor sites, and so typically same dose. But that concludes
That's this
the
batch.
intakes of this group, right?
Look at him. He's so out of it, this guy.
Well, I think he had the longest to percolate as well,
Well,
because we've sedated him at the same time as the Pearl, and then he waited the whole time we were doing Pearl, and then I did that cat Babs,
Yeah.
so he had time for it to take full on effect. But he'll be back up and at him in no time.
All right. So now they will get the results. When will we get the Ehrlichia results?
That takes about 4 or 5 days because they've got a more sensitive test for that now. It's called a PCR. We were treating in the past based on antibody results. And a dog can be carrying antibodies and not have an active infection.
Right.
But if they had a high antibody, we would need to test, or we would need to give them the
Right,
drug anyway,
right,
because it means.
Right.
But all that an antibody tells you they were infected
Exposed.
at one time.
Yeah.
It doesn't mean they're infected at this time. They now run what's called a PCR test, which actually tests for the antigen itself. So if they come back positive PCR, that means they've got
We
the
nailed
bug.
it, yeah.
Right. And so we're actually treating less animals.
When did that PCR test come out? Because I don't remember. The last batch we didn't have that.
We just started doing this year, requesting this PCR.
Yeah.
So a lot of gotta keep up.
Well, I haven't seen vaccines in my hands. I haven't, we tell
Right.
people to go vaccinate them. You don't pay
Right.
attention. But I'm surprised at the brand. And I said, what happened to Fort Dodge? What happened?
Right.
To
Fort Dodge sold
You're
out.
saying,
Right.
And we're using the people that.
We're using the company that bought the Fort Dodge vaccine. That's always been, for years, that's been my go-to vaccine company was Fort Dodge.
Well, sort of on the subject, kind of. I heard this a few weeks ago that VCA got bought out by Mars Candy.
Oh, I didn't hear.
So in other words, the vets get bought out. All the private vets get. I mean, they're offered so much money, they just
Right.
sell out. The only people who could go to Veterinary Corporation America are people that have money, and they're willing to pay the price. People who need it, the animals who need it the worst, don't get it. And there's hardly any private vets left because of companies like VCA. And you can't, on one hand, you can't say, well, who owns VCA? Stockholders.
Right.
Well, all you know is you're putting a little bit of money aside for the family, and you're buying, your guy's buying stocks. You don't know you're buying VCA, you just know you're buying stocks.
Right.
And then you find out Mars Candy bought VCA. What the hell does that have to do with veterinary medicine?
Absolutely nothing. They just showed a good profit.
Good, big profit, and it's all
But
about.
it's all about, they just have protocols that their vets are obligated to follow.
Right,
If an animal comes in with X symptoms, they run
Right.
Y test.
right,
And so you don't find much variation between
Right.
between place to place. Another thing that's changed is the demographics of just veterinary medicine as a whole. The reason that you don't see the 1-2 man practices, the partnerships, or the very small corporations is because everybody's all the new graduates are interested in quality of life issues. Go figure, right? They want to have a balance between life and family. The BBC runs James Herriot stuff
Right,
all the
right,
time, and that type of
Yes.
dedication to practice just doesn't exist anymore. It just does not exist anymore. They want to work 3 days a week, and when they're off, and somebody else is at the practice to take care of the emergencies. I remember when I started. Here we go with one of the. My dad always told me, don't listen to any story that starts with I remember. I remember when. But it was we didn't have portable phones. We had pagers, right?
exactly.
And I'm off doing something, and I get paged on a weekend, and it's my client.
Right,
I went in and took care of them.
right.
You don't see that anymore. What you see are the big corporate practices, and they have 24 hours, 7 days a week, and you don't know what veterinarian you're going to see.
I got a letter. I answered in the Dear Leo thing. I answered the things. I got a letter. The kid, he's young. He says he's 19, but he said, I wanted to be a veterinarian, and I've been, his whatever he's been studying something to get to be a veterinarian. He said, but then I find out in vet school what you have to do to animals, and I can't do that. So I don't know what I'm going to do, but I love animals too much to be a veterinarian.
That's crazy, isn't it?
Yeah, and I'm thinking, how do we get this kid? I mean, how do we train him to be a veterinarian and work for us?
Right.
I mean, to have people that care. And then you're something else. I mean, you're the best. Your dad's the best surgeon.
Well, that's,
I mean, you could do anything with incredible. So I mean, we're so lucky. But like I said, it's all changing. I don't know what the heck. What's the future for animals?
well, it's going. Well, I can say that still having family in Oklahoma, it's not that way nationwide. VCA, they concentrate on heavy metropolitan areas,
Right.
and we're a suburb of a heavy
Right.
metropolitan area, and Santa Clarita. When I first started there were only 2 vets in the whole valley, and I came in and I was number 3. So But now they all refer downtown for emergencies afterwards. You know, and it's not that bad of a drive. But I have family that still live in rural America, and you still have veterinarians.
You have real vets.
You have vets that are
Right.
taking care of their people. You
Right,
know, it's
right.
they don't refer to an emergency clinic because they're the only clinic around for 50, 75 miles.
Right.
You know, that kind of thing. So I do know they still exist, and I do know it's possible. There is that dichotomy in vet school, though, about a person that, and I'm empathetic to that. Certainly, I remember we tried to treat all of our animals with respect that we used, and I feel like that we honored their sacrifice, so to speak, but it does involve the use of healthy animals
Right.
to learn techniques. And
Well, let me just you went to Davis.
yes,
So when we did the dialysis program with Davis, we had Armando was around. We shot a 16 millimeter of everything, and I went up there. We had meetings. We shot them, and the big wigs are on camera,
right,
and we're setting up the program. And I had my vision that it had to be electronic. That because they had 3 techs for 1 dog with the old system. And they didn't have a system, but they said it would take 3 techs with 1 dog with the old systems that exist in human. I said, well, we can't do that,
yeah,
and so we developed a system. I just pushed the buttons and they did the work. But we wanted a system that was all electronic so that we'd have 1 tech for 2 dogs. So you got 2 big banks of machines and 1 tech. Now there's shifts, they have to take shifts. But 1 tech, not that it made it affordable, but it made it less expensive ultimately for for clients. So we developed the program, and along the way, one day, who I'm talking about, called me and said, we have to go to the pound and get 32 dogs for thoracic surgery. I go, why? And they said, well, to put the shunts in, we've got to I said, you're taking dogs out of the pound to do thoracic surgery to test that? I says, you can't do that. Well, we're going to find them homes after. I said, that's bullshit. That ain't going to happen. No, you can't do it. We're funding this. I get to say no. No, we're not going to do it. And we're video. I mean, we're 16 millimeter film. So they were, and I've got it on film. And I said no. So they couldn't do it. And then the other thing was that they said about the artificial kidney that they used. They said, you have a choice here. We've got an artificial kidney with a new company. It's disposable. I don't know anything about dialysis. Well, what do you use now? Well, we use glass artificial kidneys, and we wash them out with chemicals between patients. Chemicals are linked to carcinogens and stuff. And I said, oh. Well, what's best for the dog? Sounds like it's disposable. I said, what's the downside? He said, $30 a piece. Do you know what this unit cost? It's $250,000 here. $30. No, we're doing the 30. And that's the one that a couple of years later, or it's about 3 years later, we made all these magazines in the world. The dogs give back to the people. No, that's not what it was about. But the people who made the artificial kidney for our dogs went to FDA and wanted to make it for human. You don't have studies. Well, would you accept 300 dogs at UC Davis? And they said, well, yeah. So all the humans got the disposable kidney from then on from our program. So when they told me that, and I said, well, that's terrific. I didn't know anybody on dialysis. I said, that must be terrific for them. They don't have cancer. And he said, well, there's one other thing. He said, remember how you wouldn't let us do thoracic surgery? Yeah. Well, we came up with an aseptic external technique, and it works beautifully, and it saves time, and it's aseptic, and we don't have to do the surgery. Yeah. Wow. So again, we're doing what's right for the animals. And somehow, because we're doing what's right for the animals, good stuff happens.
yeah.
I forget why I said that, but you said something that triggered.
Oh, it was about the use
Oh, the
of.
euthanasia in the vet school. Yeah. Oh, and then they have an ethicist I heard at Davis. I mean, you may know about this, but they said that they have veterinary students who object to that, and so they have artificial animals that they work on.
Yeah.
They work on constructed animals instead of live ones. They don't have to kill a live animal.
Yeah.
You know about that?
I do know about that. Things have changed since I was in school, and they've
Yeah.
changed for the better. Definitely.
They're still doing that, I hope.
Yes.
Yeah.
To my knowledge.
Yeah.
Yeah.
Well, we need them. We need them all over the world. That's what this is about, by the way. Everything you're saying is going to be, you're going to be your voice and your mouth, and you're going to be, what's coming out is Afghan or German
Yeah.
or Colombian or Chinese. You're over here going to be Chinese is going to come out, but it's in your voice.
Really.
It's in my voice.
Yeah.
So the people over there, people in these foreign countries are going to hear everything that's going on. Yeah. And you know about Korea, right? The Koreans are coming
Yes.
in July. So, well, I think Jake's had it. Jake needs to get a bite.
Yeah.